Okay, we're back. This is our second crash cart here. And we're right between rooms 622 and 623. So now we're going to go to our main desk area.
We'll take a left right across from 623.
Yes. This is our visitor waiting room and the visitor elevators. You may have come up this way on your way to work. This here is where you're going to find our charge nurse. This is usually where our charge nurse sits. So if you need to locate them, this is your best bet. And then this is where our HUC or our unit secretary sits. So this is usually where you can find them. So we're going to walk through here. This is our tube system. If you've never used this before, just ask someone to help you and they can walk you through how to use it. In here we have a nutrition room. So this is where you can find water, our ice machine, snacks, drinks, everything like that. We do have water mugs up in this cabinet here that you're welcome to use to bring in as well. This is another badge access area. Before we go in this area, there is, we do heart monitor some of our patients, and these are for the batteries for the telemetry. So you're welcome to grab these if you are asked to as well. So I'll have you try your badge here. If it doesn't work at this point, ask someone to help you and let you in back here. So through this area, this is our third area of storage, or tier 3. So this is an offstage area, badge access only to get back here. And it starts to repeat itself. So we've got our west end and our east end. So this is our medication room. I'll have you try your badge here. In here, there's a few things that you'll be asked to grab. One of the main things is our IV fluid. So our main fluids we use are LR, they're labeled here, or NS, so you may be asked to grab that. There's also these drawers. So this is where we keep our patient medications. They get delivered every day, and it's by room number, so you're welcome to grab those if they are asked.
And if you are a nurse, then our Omnicell is just here in both rooms.
Awesome. Okay, and then right across from the med room is our west soil utility. In here is where you will drop off trash, dirty linen, and then dirty supplies or equipment goes here. It's labeled what goes where. This is where our IV pumps go after they're discharged. This is our return for dirty milk trays. There. We've got an employee bathroom here. This is housekeeping storage. And then this is our clean utility. This is where you're going to find the bulk of supplies. If you can't find it in tier 1 and tier 2 that are out in the hallways, this is a great place to look as well. We have everything labeled by category. We've got wound care supplies, extra isolation supplies, GIGU and hygiene items. Also over here we have wipe warmers where you can get stuff for bed baths if you're asked. Extra linens here, blanket warmer here, and then extra pillows right there. And then
I'm gonna go out and to your left.
Yes, we're out. There's 2 doors here. If you notice, they will go out to the hallway. We have patient rooms on both sides of us. Those are entrance and exit points right here. So it does have to have a badge access in here, but no, you can exit out at any point. This is extra IV lab supplies. You shouldn't need to get in this area. Everything that we need or use most frequently is out in the rooms. This is our respiratory closet. We are the respiratory unit. This is mostly used for our respiratory therapists, but I'd like to take note that this is, in this green bin, is full oxygen tanks. And then we put empty oxygen tanks right there, right next to it. Right across the hall is our storage or our equipment room. So in here, you will find, these are our walkers. You usually will find commodes in here. This is our bladder scanner. This is a commonly used item, so that you may be asked for that. Also back in here, we have IV pumps and channels. This is our air taps blower, if they reference that. These 2 carts here is what we use to stock our nurse servers or tier 1. So if any items are out of stock there, this is a great place to look for them. And then we're gonna come through this way. This is where we start to repeat ourselves. So we've got another nutrition area. this here, if you notice these signs, this will point, at least in this area, will say which patient room is right outside these doors. So it kind of gives you a reference of where you're at. We have extra stock for this nutrition area over here. And then our nutrition area over here, you've got all the snacks. This one is fully stocked. Also down below here, you've got ice packs and heat packs, extra mugs, feeding tube supplies, and then everything in the fridge there. Here's another dirty utility, same setup here. Dirty meal trays, another medication room, employee bathroom, and then this east clean utility, we're actually dwindling down on supplies and we're going to use this room for something else. So I'd go to the west clean utility first if you need anything. It's very minimal items in here, but there is a blanket warmer that you're welcome to use in there. And then we're going to go out this east door now. These doors are automatic if your hands are full. Keep that in mind. Now we're on the east end, so those are the employee elevators straight ahead. This here, we have another tube system. This is where our pharmacist sits during the day. We have a patient board here. And then through here, let's talk
Isolation?
sign.
Yeah. Let's go down
Let's
to.
go down here.
So we are now.
Walking by 634.
So you should be at room 634.
This here is this is where we keep all our isolation signs. One that we want you to keep an eye out for is this droplet contact precautions. This is the one we need our compliance check on. Everyone going in should be wearing a gown, goggles, mask, and gloves every time they go in. Just making sure we're donning and doffing or putting on and taking off these isolation items correctly. If there's any questions on transporting these patients, there's guidelines on the back here.
And that will just be hanging up in the door.
Yes, so if they're on these isolations, it'll hang right here. And that way you know you are not to enter these to help preserve our PPE, but to watch for compliance.
Perfect. If there is no sign up on the door, then that means the room is either empty, like this one, or they are not on isolation.
Perfect.
Okay. Let's do a quick.
Yeah.
Just want to say thanks again for being here, for helping us out. We're glad to have the extra help.
We appreciate you guys so much.
Abby and my phone number are on the bottom of your reference sheet. You are welcome to reach out with any questions or concerns. And also, if you notice anything that can help our team be better, we would love your ideas and insight. Thanks for being here. Good luck on your shift.
Thanks.